Welcome to Obstetrics and Gynaecology module. In this module, we're going to talk about the inspection, diagnosis, and treatment methods that we use in obstetrics and gynecology clinics, and special skills and simulations of gynecological techniques. As gynecology department, we are responsible for the reproductive physiology and endocrinology, pregnancy and methods of diagnosis, pregnancy physiology and problems, parturition, oestrus synchronization and methods, embryo transfer, in vitro fertilization and maturation, reproductive biotechnology and methods, puerperal period and problems, infertility and sterility, gynecological operations, mammary health and diseases, milking and milking hygiene. We have four main inspection methods that we routinely use in our OBGYN clinic. Vaginal inspection, rectal inspection, ultrasonographic examination, and radiographic examination are the four main inspection and examination methods that we use. For vaginal examination, we use the vaginoscopes or the speculums to visualize, to see the inside of the vaginal mucosa. It helps us to see if there's any tumors or if any pus comes out, and it helps us to determine where the pus is coming from, or it can help us to determine which phase of the oestrus cycle the animal is in. It has different sizes and thicknesses, so you will choose the appropriate one for your animal and your animal's size. For vaginal examination, the first thing you want to do is to have a 45-degree angle to place the vaginoscope, and then you want to turn it to a parallel phase. And after that, you can use a pen light, or you can use an endoscope to see what's happening inside. It will help you to locate where the bleeding or the pus is coming from. It will help us to determine which oestrus cycle the animal is in, or if there's any tumors occurred. In the vaginal examination, to determine the oestrus phase, when you perform a vaginal examination, you will see different types of mucosal. You will see the mucosa is changing depending on the oestrus cycle. And in proestrus, in early proestrus, you will see that the mucosa is more pink and it has edema. At the end of the proestrus, the edema is much more visualized, and in oestrus you will see that the mucosa is pale, and it's pale white, and it's the mucosal borders seems more rigid, and it is because it looks like it's more dehydrated. And on the oestrus you will see no vaginal folds, and the color is close to a pinkish white. This is how we determine the oestrus phase. On proestrus, you will see in this video, in dogs we can have some bleeding because it's a physiologic thing that you will see a bleeding in the dogs on proestrus phase. You can see that the vaginal mucosa is more pinkish. It's kind of a unhealthy pinkish color, and the vaginal folds does not occur. It has more edema than the oestrus phase. On estrus, you will see that the mucosa looks more wider. It's it's more like a pale white color, and you can see the vaginal folds occurring. It looks like it's dehydrated, and the color is more close to white than being pink. Ultrasonographic examination is what we perform literally daily on our clinic, and it helps us to see inside the abdomen. It's a non-invasive technique. It can help you on different matters, not just the pregnancy, but we use it mostly on pregnancy detection. When you have an animal which is pregnant, you will see the gestational sacs first. This is what's going to help you to diagnose that patient with pregnancy. You can see it's in here. We have 5 litters, and in ultrasound you can't give the patient that it has certain numbers of babies, because it's not appropriate to give how many babies inside. In early pregnancy, when you do an ultrasound examination, you will see all of the gestational sacs, but in case of an early embryonic death, this number will decrease. That's why you don't want to give any certain numbers, how many babies inside. You can't say how many babies it's going to have. The first day that you can perform an ultrasonographic examination is the 30th and the 35th day. In the 30th or 35th day, you will see there is a gestational sac and the embryo inside. After the 35th day, it's around 30th day, you will see the baby getting bigger and the sac getting elongated. You can determine the baby's body, baby's head, and the umbilical cord. On 35th day, you can determine the head, the limbs, the body, and the umbilical cord again. But at this time, you can see the heart and other organs differentiating, and you can count how many heartbeats per minute the babies have. So that's an important day for you. At the 45th day, you will see that the skeleton will occur, and this is specific for late pregnancy. You can see the cranium, you can see the ribs of the animals, the babies, and this will help you to measure the baby's head. To perform an ultrasonographic examination, you will need to shave the area properly, and you will use an alcohol solution, preferably 70% alcohol, which will remove the sebum from the skin, so that's way you're going to have a better visualization. And then you will use an ultrasound gel. The first reason that you can't say how many babies are inside was the early pregnancy, but in the late pregnancy you can only see one baby at a time, so that's why you can't say how many in there, because you can count one baby twice or more. That's why it's not appropriate to give numbers in ultrasonography unless you see one baby and the other at the same time. You can say at least 2 babies are inside, but other than that, it's not appropriate to give numbers. So if you can't give any exact numbers or how many babies inside, how can we do it? We can do it by radiographic examination. In radiography, of course, you should do it. You should perform a radiographic examination after the 45th day, because there's no skeletal earlier, and after 45th day, it has no harm for the baby. You will count the craniums, how many craniums are inside. In this picture, we have 11 babies inside, so you should always count the craniums. And if the birth is going to be normal, or if the patient is going to go to a cesarean section, by measuring the head of the baby and measuring the mom's pelvis and this it has a specific formula that it will say if it's going to be a normal birth or if it's going to be a C-section. In this picture you will see we have 4 babies inside. When the birth is getting closer, you will see that mother's mammary glands will have edema, and you will see them laying around all the time. If you're going to help the parturition or the birth, first thing you need to know is the thing that starts the birth process is stress. So when a baby gets stressed inside, it will cause stress hormones to signal the mom that it's time to birth. But when mom gets stressed, she will stop the birth process because she thinks that it's not safe here. So when you are going to help the birth process is make sure it's not going to happen without your help, because unless it's a normal birth process and you stress out the mom, then she will stop the birth process because of the stress hormones. And you see in this picture, the babies comes out in a clear sac. So if you're going to help a birth process, then the first thing you should do is not stressing the mom, and then when you see a baby coming out, you should clear its mouth and nose area from this sac, and then you remove this sac with any cloth, clean cloths. Make sure you wear medical gloves, because when the mom senses your smell on its baby, she thinks that it's not her baby. That's why we always use gloves in reanimation of the babies. After you clear the mouth and the nose, you have to cut the umbilical cord. Make sure you don't cut it too short or too long. It's ideal to cut it from 1 or 2 centimeters away from the baby. It's better for you to clamp or do a ligature on the umbilical cord to prevent any bleeding from the baby, because they don't have have much reserves of blood, so any small bleeding is dangerous for the baby. And then you will dry them. If the mom doesn't take care of the babies, you have to keep them warm always. You have to feed them in 2 hours periods, and when they're younger than 15 days, they can't regulate their own body temperature. So that's why you have to keep them warm always. And in the first weeks, they can't pee or poop by themselves. That's why you are going to massage the area just like their mother licking them. So this will help them to pee and poop. As gynecologic operations, we perform daily. Usually we have ovarian hysterectomy, but you can perform an ovarectomy or hysterectomy. Ovario means ovarium, hyster means the uterus, and ectomy means taking out an organ in the abdomen from the patient with an operation. So when you do an ovarioectomy, it means that you only take ovarium, or hysterectomy, which means that you only take the uterus out. But ovariohysterectomy means you are going to remove both ovaries and the uterus from the patient. So this is the normal anatomy. You will see the uterus under the urinary bladder. When you go inside the abdomen, first you need to find the uterine horns. Then you will follow them from the cranium, the cranial side, and you will find the ovary. And after you find the ovary, you will place a ligature inside, which will stay in the animal to prevent any bleeding. And then you will cut the ovarian ligament and the veins, and then you will the other side, and you will perform the same thing on the other ovary. When you carefully remove the ovaries, then it's time for you to remove the uterus. To be able to remove the uterus, you have to perform ligatures at the corpus uteri, which will be a couple centimeters down from the uterine bifurcation,